Hello all. Today we are going to discuss about Graves' disease. Graves' disease is an autoimmune disorder in which immune system attack healthy tissue in thyroid gland for unknown reason. It is also known as toxic diffuse goiter. It is the most common cause of hyperthyroidism, a condition in which thyroid gland makes too much thyroid hormone and often results in enlarged thyroid. The condition gets its name from Robert Graves, an Irish doctor who first described the condition in 18th century. It occurs about 7.5 times more often in women than men. Causes of Graves' disease. Graves' disease is caused by an immune system produced an antibody called thyroid stimulating immunoglobulins, is also known as thyroid stimulating antibodies. These antibodies bind to receptors on thyroid cells and stimulates the thyroid gland to produce excessive amount of thyroid hormones. The exact reason why the immune system produces these antibodies is not fully understood, but genetic predisposition and environmental factors are believed to play a role. Symptoms. The symptoms of Graves' disease are varied and can affect multiple body systems. Some common symptoms include nervousness and irritability, anxiety, difficulty sleeping, fatigue, weight loss despite increased appetite, rapid irregular heart rate, increased sweating and heat intolerance, tremors, enlarged thyroid gland, goiter which may cause swelling in neck, changes in menstrual cycles, frequent bowel movements, muscle weakness, hair loss or change in hair texture. A significant number of people with Graves' disease also develop Graves' ophthalmopathy, thyroid eyes disease, which affects the muscle and tissues around the eyes. Symptoms of these conditions can include bulging eyes, gritting or painful eyes, pressure in the eyes, puffy or ductured eye, red or inflamed eyes, sensitivity to light, blurred or double vision, in rare cases, vision loss. Less commonly, people may experience Graves' dermopathy, which causes the discolored skin, usually shines on the top of the feet. Diagnosis: physical examination, medical history, blood test. So in blood test, we will check thyroid stimulating hormone. In this, thyroid stimulating hormone levels are typically low because the excess thyroid hormones produced by the overactive thyroid suppress thyroid stimulating hormone production by pituitary gland. Thyroxine and trilodothyroxine, that is T4 and T3, these are the main thyroid hormones in Graves' disease. Their level usually elevated, indicating hyperthyroidism. Thyroid stimulating immunoglobulin or TSH receptor antibodies. Positive of this can strongly suggest Graves' disease as a cause of hyperthyroidism. Thyroid peroxidase antibodies and thyroglobulin antibody, indicating autoimmunosuppressants affecting thyroid. Radioactive iodine uptake test. In Graves' disease, higher uptake of radioactive iodine because it is overactive and working harder to produce hormones. Then thyroid scan, Doppler ultrasound. Treatment. The primary goal of Graves' disease treatment are to reduce the overproduction of the thyroid hormones and alleviate symptoms. The main treatment include radioactive iodine therapy. Taking radioactive iodine therapy orally while is absorbed by thyroid gland and gradually destroys the overactive thyroid cells. This treatment often leads to hypothyroidism requiring lifelong thyroid hormone replacement medications. Antithyroid medications, then beta blockers, thyroid surgery. Treatment for Graves' ophthalmopathy may include over-the-counter artificial tears and lubricating gels for mild symptoms, corticosteroids to reduce swelling and inflammation, prisms in glass to help with double vision. In severe cases, orbital decompression surgery or orbital radiotherapy may be considered to relieve pressure on the optic nerve. Thank you.